Typhoid fever. Typhoid fever is a bacterial infection. It can cause a severe systemic illness consisting of fever and abdominal pain. The organism responsible for this illness is Salmonella typhi. Typhoid fever is more common in children and young adults than in older patients. It is spread easily in poor, overcrowded areas with poor sanitation. Sometimes when people get sick with typhoid, they get better but still carry the bacteria in their bodies. These people are called chronic carriers. A chronic carrier can contaminate food and pass the infection onto anyone that consumes the food. Then that person gets sick with typhoid. Some patients are chronic carriers of Salmonella typhoid even though they are not sick. They continue to excrete the organism in their stool or urine. To prevent this, it is important to remember good hand hygiene. Salmonella typhoid only affects humans. There is no animal or insect that can transmit the disease. The disease is passed on from person to person by direct contact or indirect contact by contaminated food or water. The bacteria is able to survive exposure to stomach acid and makes its way into the small intestine, where it penetrates the lining of the intestine and can enter the lymphatic system or blood and spread to other parts of the body. Your job is to remember to consider typhoid fever in any patient with abdominal pain and fever. You should look for signs of dehydration, confusion, anemia, and peritonitis. To assess for confusion, you can ask the patient their name, where they are, and what year it is. You can also ask family members if the patient is acting like his or her normal self. To assess for dehydration, you can look at the patient's tongue to see if it looks dry. Other signs of dehydration are a fast heart rate, meaning a heart rate above 100 beats per minute, a low blood pressure, meaning a blood pressure below 90/60, cold extremities, and a capillary refill greater than 3 seconds. To check for capillary refill, you can press on the bed of a fingernail until it blanches, release, and count how long it takes to return to normal color. More than 3 seconds is abnormal. Patients with typhoid fever frequently have anemia from blood loss in their stool. It is important to look for clinical signs of anemia, such as pale skin, pale conjunctiva, pale tongue, fast heart rate, shortness of breath, chest pain, and weakness. Patients with anemia from blood loss might require a transfusion. You also must be able to identify people that need to be taken to the hospital. Any patients with signs of peritonitis on exam. Peritonitis can happen because the bacteria can cause a hole in the intestine. This needs to be sent to the hospital immediately. Other red flags include confusion, dehydration, anemia, or septic shock, which is defined as a heart rate greater than 100, a blood pressure less than 90/60, cold extremities, and a capillary refill greater than 3 seconds. Patients in septic shock will look very sick. They may have a fast heart rate, above 100 beats per minute, low blood pressure, below 90/60, with warm extremities and capillary refill less than 3 seconds. When you are seeing a patient that you think might have typhoid fever, you should ask the following questions. When did the fever start? Does anything make the fever better or worse? How high is the fever? Is the fever every day? What are the associated symptoms, such as abdominal pain, diarrhea, constipation, blood in the stool, black stools, or a rash? Examining the patient. The majority of patients with typhoid fever present with abdominal pain, fever, chills, and constipation or diarrhea. The onset of symptoms usually occurs approximately 5 to 21 days after ingestion of the organism. In the first week of illness, patients develop fever. Pulse temperature dissociation may also be observed. Pulse temperature dissociation refers to the phenomenon seen in typhoid fever where patients may have a fever and have relative bradycardia, a heart rate with a fever that is less than 100 beats per minute. Usually, when a patient has a fever, they become tachycardic, meaning their heart rate is above 100. But with typhoid, they will have a fever and a heart rate that is less than 100. In the second week of illness, patients develop abdominal pain and may develop rose spots. Rose spots are salmon-colored spots that show up on the abdomen or trunk. In the third week of illness, you may notice a large liver, which you can feel in the right upper quadrant of the abdomen, or a large spleen, which you can feel in the left upper quadrant of the abdomen. The patient may have blood in the stool, which will show up as bright red blood or black tarry stool, or they may have peritonitis, which is inflammation of the abdomen that can be diagnosed when a patient has severe abdominal tenderness. Oftentimes, they will be unable to do a sit-up or jump up and down because of the pain, and it will hurt them when you knock their bed. If the illness goes any longer without treatment, patients may develop confusion and septic shock, or a perforation of the intestine. That means a hole in the intestine. Treatment. The treatment for typhoid fever is antibiotics and hydration. The antibiotic of choice is ciprofloxacin for 7 days. In children, the dose is 15 milligrams per kilogram twice a day, and in adults, the dose is 500 milligrams twice a day. It is also important to make sure the patient stays well hydrated by either drinking lots of fluids or by providing IV fluids. Make sure to tell your patients to follow up in 2 days or sooner if they have new symptoms or are feeling worse.